Now that we know what insulin is and the role that it plays in regulating blood sugar, we can look at how it's related to type 1 and type 2 diabetes. We can do this by comparing the glucose and insulin concentrations in the blood of a healthy person, of a person with type 2 diabetes, and a person with type 1 diabetes. This will give us some insight into how we can treat these diabetes cases and also how we can diagnose them. Diabetes mellitus is where the body does not adequately process glucose. There are two ways in which this manifests itself. Type 1 diabetes is where the pancreas does not create insulin, and therefore glucose released into the bloodstream does not get absorbed by the cells. And type 2 diabetes is where insulin is produced and released into the bloodstream, but cells do not react to the insulin. The cells are insulin resistant. A good way of illustrating the effects of diabetes, and also a way to tell if someone has diabetes or not, is to look at their blood response after they eat a meal. We look at the concentrations of glucose and the concentrations of insulin in their blood after they ingest a large meal. In a healthy person, after they eat a meal, glucose levels in the blood rise. In response to the increased glucose that needs to be absorbed into the cells, the pancreas creates and releases insulin. That insulin is then used by the cells to absorb glucose, and therefore there's lower glucose concentrations in the blood. When the pancreas notices there is less glucose in the blood, it slows the production of insulin. So in a healthy person, blood levels of glucose and insulin should closely mirror that of each other. And we can expect that a few hours after a meal, a blood test would reveal low, consistent levels of glucose and insulin. In a person with type 1 diabetes, their insulin levels remain low throughout this whole time period because their pancreas is not producing insulin at all. Now, when we eat a meal, our glucose levels still increase as usual. However, because our insulin levels are low, the glucose levels continue to increase. In fact, if we looked at specific time points throughout this period, we'll notice that the glucose concentrations are quite high, especially at the middle and end of the test. However, at those same time points, the insulin levels remain low because the pancreas does not produce insulin at any time. In a person with type 2 diabetes, when glucose is released into the blood, the pancreas releases insulin like usual. But the insulin receptors on the cell fail to respond to the normal levels of insulin, and therefore most of the glucose is not absorbed into the cell like in a healthy individual. The pancreas, sensing that there is still glucose in the blood, continues to make insulin. Eventually, there is enough insulin in the bloodstream to trigger the insulin receptors on the defective cells, or to make normal cells absorb more glucose to compensate. Glucose levels then go down, and the pancreas stops making insulin. If we took blood samples during this post-meal time, we would realize that both blood glucose and blood insulin levels are very high. These sustained high levels are apparent for some time after the meal. However, this is a problem for multiple reasons. First, there is a longer than usual period of sustained high blood sugar. Second, by constantly producing very large amounts of insulin, you can lead to the beta cells in your pancreas that produce that insulin to get tired over time. And as time goes on, you may start producing less and less insulin, slowly leading to type 1 diabetes, where you don't actually produce insulin at all. Now that we know how an individual with diabetes responds to a meal, we can look at how to treat the problems that are caused by diabetes. I mean, this is wrong, I guess. So it's funny because in some places you did, in some places you don't. The political correct way of saying diabetics is person with diabetes. However, in that time, the individual with type 2 diabetes normally, dude, you gotta calm down. Your phone's right here.
There's my phone.
Dude, you gotta, does it look like I'm reading?
A little.
With this knowledge to identify diabetes type 2, as well as prediabetes with a blood test after a meal, you would see this is not a very good description. So I'm gonna explain this differently.
Fine.